now more interactive session, which is a panel discussion led by none other than our Gajendra Gupta sir. Sir is presently working as a medical director of hospital and head of department of pathology and transfusion medicine at Santokba Memorial Hospital, Jaipur. And sir is also lead assessor and accreditation committee member since 2002 of NABH and also NABL. So sir is also a former technical committee reviewer and also an committee member since 2007 to 2017. So was instrumental in developing the standards of quality assurance and blood bank standards of Quality Council of India, which is well appreciated and noteworthy thing. So over to you to introduce the other speakers and over to you to take out the panel discussion. Sir.
Good evening, everybody. We'll come to the panel discussion. And I think we have a good number of panelists with a great experience. So the first panelist is Dr. Kiran Choudhury. She's heading the Department of Transfusion Medicine and as well as consultant of Transfusion Medicine in RML Hospital, New Delhi. And she has got more than 34 years of experience. And let me tell you, in spite of all the research papers and her interest, she is steering up a counselor training program, which we have seen has become mandatory now in blood transfusion services. And she has done a wonderful job with government to create a human resource which were new to the transfusion medicine. So we'll be hearing from her. Second speaker we have, second panelist we have Dr. Arundhati Giri. And she's chief of nursing of Woodland Multi-Speciality Hospital. She's MSc in critical care and she's also looking after infection control at the hospital. And she has got a vast experience with multiple big hospital in Calcutta. She has worked in majority of the big hospital in Calcutta. And third, definitely we have heard Miss Anusha K. And she's such a wonderful speaker. I should really congratulate you, Dr. Miss Anusha. And she's BSc and postgraduate diploma in critical care nursing. She's also an MBA in healthcare. And she has got 14 years of experience. And she's presently working as Dr. Rela Institute of Medical Center, Chennai. So I think we'll proceed with a few of the discussion points with the specific specialization which our panelists are into. So I'll begin with Dr. Kiran Choudhury. So Dr. Kiran, you have a vast experience in training donor counselor. As we all know, you have run this program and you have run this program for ATOM as well as NACO also. So how do you think, what's the role of counselor in ensuring the quality of the product? Where we say that is the counselor really required? And if required, then what kind of training are you imparting and what kind of training they should have?
Thank you, sir. It's my privilege to be here, sir. And thank you all the organizers. As you said, that counselor is very essential to our services. What do we do is we just use a very simple tool, and that tool is a donor questionnaire, which is very cost efficient. But how to administer that simple tool, the skills are required. And I feel the counselor is the face of our blood bank, of our blood center, because all the donors will first meet the counselor mostly. And it is the counselor who has to ensure that the donor responds correctly and is able to elicit the right answers. So this is a skill actually, as you rightly said that we are running a program. Presently, it's being run by NACO. A few years back, we did it with AATM for the private sector blood banks also. So this is a 3-day curriculum. And here we are teaching skills to the counselors because it is not very easy to elicit the information, especially the confidential information, personal information, which we all know that if a counselor is efficient and is able to elicit the correct information, we will be able to weed out a lot of window period infections. In addition to that, I feel that the counselor is there to build rapport with the donor. You know, the way the counselor behaves and the impression the counselor gives about the blood center goes a long way in retaining these donors. In addition, those donors who are having diseases other than TTIs can also be taken care of by referring them to the right places. Like we see that more than 50% of our population is anemic. So anemia is a really big challenge where our counselors can simply advise them on the diet they have to take or refer them to the physician or the appropriate places. So the first thing which we teach these counselors is they should know the frequently asked questions by heart. So generally it is the donor screening criteria like the weight and hemoglobin and other things. In addition to this, there are many questions which the donors always ask. So we have listed out those questions and we teach them that. Then they have to explain the whole donation procedure, what precautions they have to take during the post-donation time, and they have to sign the informed consent saying that if they are TTI reactive, they have to be informed. What they have to do after TTI, they are found to be TTI reactive, how to break this news to them. You know, this is the most important part. It's very difficult to break news of TTI reactivity to the donors. So as I said initially, if the rapport building is good, then all this thing easily fall in place. In addition, then what to do if there is an adverse reaction and referral of these donors to appropriate places. So all these things are taught to these counselors and they have to explain all these things to the donors. Now, the techniques which are taught to them is to be a very, very good listener. So what we tell them is that you will use very little words, you will use simple words, and you will try to extract information from the donors. Talk less, get more out of them. So by positive listening, information gathering, and some supportive techniques. So like supportive techniques we normally use when we have to break a bad news to them. So you have to comfort them and the way the news has to be broken, it has to be in 3 layers, you know. So all those techniques are taught to them. And as I said, that there is, you know, something called, I read somewhere something called intangible quality, you know, which cannot be actually measured or quantified. But the way the counselor presents himself or herself, the body posture, the pleasing personality, how professionally they can talk to the donors, these are some things which you can't actually measure, but the donor feels, the donor gets a feeling and perceives that this is a good blood center, and it helps in developing trust with the blood bank. And then this donor can be converted into a repeat regular donor. Thank you.
So it's a 3 days course, as you have told. So is it still running, ma'am?
Yes,
With
it's
lack
running.
of support? So
Yes.
I'll come back to you again because I would want that participant should know how to apply for it. And is it for government only, or we can apply as a private also? So
Presently,
I'll come back. Yeah, I'll come back to
okay.
you, ma'am.
Okay.
Because this is what good for all the users who are attending the webinar. So how to get your counselor trained, and it will be easy if you can give us your email and contact number in the chat so that people can note it down if they want the counselor to come. So I think the next question, I'll come back to you, ma'am, again. Next question I have for Arundhati Giri. What are the common challenges faced by a nursing staff in ensuring safety of entire transfusion chain when we say?
So, thank you, sir. So I am privileged to take this opportunity also. So safe transfusion only 2 words, but nurses may lead to the major role to play for that safe transfusion without any error. So few things always is required. One is the communication skill, knowledge, and documentation part. So in terms of skill, we can say that obviously the transfusion occurs means IV access. So nurse should have that IV access, that's the skill. And another is the communication skill. Communication skill is the major part because only 2 words, but nurses should liaisoning between the doctors, patients, family members, and the other test sources like laboratory, blood bank, and even the GDS stuff. So communications also it is the major roles. And apart from that, knowledge also we have to we have to keep in our minds. So as a knowledge process of blood transfusion, even though during transfusion that bedside checked, what all things we have to check, means every points we saw that it is checking, but again whenever bedside we are going to transfuse, then you have to recheck that identification of the patient regarding blood group, APHO, RH typing, and type of components, and even the visual inspections of the blood bank, and that blood components in the instance of that step of transfusion, rate of transfusion, and monitoring part. So here we can say that all the points we have to, it is challenge for us to communicate to all others peoples. So every moment nurses are that facing challenges to coordinate, like a direct documentation, means documentation part, even though we are considering. So that is the two parts. One is the direct documentations, another is the indirect documentation. So indirect documentation is there. So doctor's orders, it is there or not, it is properly written or not, and even the requisition form also. So sorry to say, because doctors are so maximum times they are not properly documented. So half of the columns or rows, they are not written properly. So again, they have to face a check and make sure it is correct, and then you have to say it. And in terms of the consent also. So consent, same way the documentation parts, they are very lax. And we have to coordinate with the patient relatives. They have to be there. And patients also that communications. And we have to communicate with the doctors for that getting that consent. So like that way, that is very challenging, but only 2 hours, but we have to face that lots of challenge. Now that blood issue forms, that is documented by the sisters, but again, transportation part, that is really that safe manners we are transporting that, even though blood requisition forms with samples, and whenever blood is ready, after that communications also, it is same manners it is in the ward. During transportations also, like the temperature maintenance or not. And other than that, they have to knowledge of the that all these points already mentioned, the rate of the transfusion, step of the transfusion, and even the monitoring chart. So monitoring what all things is like the during transfusion, so what all the vital signs they have to check. So frequency already, that's previous speaker already in details already explained. So I will not go in for that. And as a nursing staff, so we have to monitor that adverse reactions also. So as a, we are not going too much details, but as a nursing point of view, few signs and symptoms we have to make a so we have to inform doctors. We have to miss early diagnosis also, like that if patient is during transfusion, fever, shortness of breath, chills, and unusual itching, chest pains or back pain, and sense of uneasiness. That is the during transfusion. And after procedures also, we have to check few things. So if it is, we have to remove the cannula. After that also, any sign of the infections and phlebitis, anything is there or not, and adverse signs and symptoms still there or not. And overall, that all these points is there, and even though before starting also, we have to very much clear that cannula, that expertise of the IV access, and if it is IV access is there, so what we have to check for, and means if it is we have to flash the line. Competent means you have to competency check the patency also, that cannula. But if it is patency, so that what solutions we have to check for the patency? So like that you have to isotonic normal silence you have to use. That also you have to keep it in mind. So all these procedures, nurses are challenging. That most challenging part is if it is that highly attrition rate and multitasking. So during multitasking, because it is not possible. So one example, after means whenever we are starting that blood transfusion, 15 minutes close monitoring. But if nurses have that another that 5-6 allocations, so how to close monitoring for one patient 15 minutes also, that is also challenge. So concluding that, I mean to say, if it is specialized for the transfusion, a team is there. So I think that without any error, without any hesitation, without any challengings, we can transfuse better way.
Thank you, Ms. Arundhati. We'll come back to you.
Gajendra, sir,
yeah.
I'm sorry to interrupt. Dr. Rahul is connected. So shall we finish the panel and go to him, or?
We'll continue with panel first,
Okay.
and we'll finish it fast. We'll not take much of the time. Then
Okay.
we'll continue.
Done. I request Dr. Rahul to just stay connected, please, if you don't mind.
So I think my next question is with Anusha. You see, as Arundhati has told, the motivation, the challenges of nursing staff. So how to actually maintain it? And initially, when we induct a nursing staff or even a junior resident or a resident or a doctor, everybody is motivated. But over a period of time, we don't see the same kind of motivation in the team. So how do you do that? Do you have some specific procedures for doing it?
Yes, sir. Thank you so much for asking a wonderful question. Actually, I would say that actually, this is, I can say this is a universal problem. Actually, this problem seem to be in a little difference in each and every setting where we cross across and go about. But to say that actually, when it is starting and declining, we should be very clear from the top to bottom approach. It should be there. So leadership commitments and involvements makes a bigger role. So each and every transfusion medicine department should have a clear-cut defined vision and goals and what they are going to be led on and in which way they are maintaining it. So if I say that my vision is to maintain these many things and this is my target line, these are my clear-cut defined objectives and measures. So definitely the team will be working towards it. We should be having the clear-cut things over it. And the next point I would say is your team building cultures and other things. So when we say that we are working as a team, so definitely it makes a bigger difference. So if you're going to say that, yes, we are as a team, that means from the top leader of the department who is heading the transfusion medicine till the support services staffs, everybody is working towards a common goal. That's very, very important. It is not like you and me. It is like we concept which need to be into the system for us to take and go ahead. That's very, very important for us to maintain any goals into the organization. And then is your positive work culture. So I can say it is a just culture or a blame-free culture where we say that there are any systems in place, we have challenges in making errors. Humans are tend to make errors. We cannot guarantee that humans is error-free environment. That is not at all possible. When humans are involved into the process and making the systems and things, we have to make it as a positive one. If there are errors in the system also, we should have a free reporting culture for them to say, yes, it went wrong. So what can be done? What are the challenges in my systems or the processes where I can address and take it forward, or what address the loopholes and get it closed so that I can prevent those errors into the future. So that your culture and your positive culture and a reporting culture makes a good difference in having it. And we also we should give the opportunities for each and every members in the team to take part in all the initiatives which they are doing. It is not, oh, it's me, it's you. So each and every member should be given some responsibilities. We should have a clear-cut identified responsibilities for each and every team member so that everyone is into the system. It is not like one time the system comes in, system goes in, or like it's like a festival and going. It is like a journey is very continuous. The process is going to be there, challenges are going to be there with the manpowers coming in and going with the various stakeholders involved in the transfusion services, starting starting from doctors, nurses, support services, whomever it may be. But your responsibility should be there. There should be always a constant drive of the processes which needs to be other to it, and it should be a constant driving force, which is with a form of a continuous reinforcement, education, trainings, workshops, and other things that has to be there. And the team has to be really, we should bring out the things, sort of feeling that each and everyone is accountable. They should be empowered enough to take the systems into their hands. The ownerships and the accountability should be built into the each and every employees. If you have these things, yes, employees will feel, definitely will be motivated to get that systems in going ahead. And the commonest other things to have it is like each and everyone will feels like, yes, they are comfort in one zone. That maybe call it as a comfort zone or a luxury zone where they are put in. When we have a lot of changes, systems and policies put into the pace, people coming from different places or people who are into it, they may not be adapting to the new challenges. So those things all also need to be addressed and taken care of. So I think this will.
Okay. We all really need to hear from Dr. Rahul. So second question we'll finish on very fast. So I request my
Yes.
panelists to answer it very fast. I come to Dr. Kiran again. So you have done so many training. You are in touch with all the counselors. So can I know a few of the challenges which these counselors are facing with the donors?
Yes. So I have worked with diverse set of counselors from different parts of India. And I will just list three of them. So one is manpower shortage. All of them say that we should have it in some proportion, how many counselors per what is the collection of the center, because there is just one and there is too much work for them. And this is the, all healthcare services are ailing with this problem of shortage of manpower. The second is the replacement donor versus voluntary donor. Now, replacement donors, they have actually come here to save the life of their patients. And it's very likely that they hide facts and they do not express themselves properly. So there was a suggestion, and what even I feel personally is that we should have some units reserved for such donors who, if we defer, we can help from our side and we don't coerce them into donating. Then we'll be able to elicit the correct response from them. So there should be this assurance from the side of the blood centers. And thirdly, which is the most important one, is counseling in the camps is very difficult. So they all come in groups. So here pre-donation information works. Information is something which we can give in groups, in gatherings, we can announce it. But counseling has to be one-to-one because these are very personal, confidential questions. So my suggestion was that you can have them in a phased out manner, give them time slots so that a group of donors come at one particular time. So with the organizers, you have to try this. And then by practicing the skills, the counselors can actually sort out the questions which they feel are important and not ask them lengthy questions, or for doing it quickly, they should develop this practice of sorting out a few questions, selecting a few questions and asking the donors. So this way also we can help in camps. Thank you.
Thank you, ma'am. Thank you, ma'am. My next question to Ms. Arundhati, I request you to keep it short. Transfusion nurses, do you think this will help? Because few of the countries, few of the hospitals are started this course.
Pardon, sir?
Transfusion nurses courses, few of the hospital in India have started this course. Do you think it will help in quality maintenance?
Yes, sir. I am thinking that it will be very much helpful. So I agree with Madam Anusha also. So whatever she suggested. So in terms of that education, patient blood management, leadership management, even though communication skill, and even though they can focus the data management, and even though performance of the transfusion, audit part, and practice developments also, and that hemovigilance. So all this part, they can take a lead, and even though knowledge partner has a skill, ability, and they can take care of that, all these points. So it is very much required. So they can more focused and train them. So like a team.
Yeah. Thank you, Arundhati. Now, my last question with Anusha.
Yes,
So you are a quality manager of such a big hospital. So what should be the roles and responsibility of a quality manager in transfusion services, if I need to?
Yes, sir. So when we say that your roles and responsibilities of the quality is a main thing, actually the quality manager is responsible for implementing the quality assurance and quality management systems into the blood transfusion medicine services. So once that is done, then the person should be, he or she should be knowledgeable in understanding the standards, interpreting the requirements, what it's required and how it needs to be implemented. That is the first and foremost thing should be into it. And the quality manager should keep the system as continuously ready towards the thing. It is not only the auditing, which is going to come in once in 2 years or once in 3 years surveillance or auditing, reaccreditation, whatever it is. The organization should be ready 24/7 for all the systems in place, actually. So all the laid down policies and procedures has to be adhered every day in and out. That's a very big thing. So quality manager is responsible to ensure that's been implemented 24/7 round the clock, and ensure that the continuous training and education is given to all the staffs involved in the transfusion services. And the person who's as a quality manager should have a good sound knowledge on your problem solving skills, the identifying your problems, and should be keen enough in analyzing the things with your RCAs, problem solving, identifying what went wrongs, and suggesting for an perfect corrective and preventive actions for the things which is going wrong into the system. That is also very important. And one more important skill the quality manager should have is a strong interpersonal skill. Actually, that's very, very important for us to go around, get around and into the team and understand them. Yes, what has been required. So it is not like a bossy culture. It is like get along with them and understand. We have to participate in each and every activities of all the teams does in the transfusion medicine services and make them implement what we want. And we should be always ready to be like adaptive to the changes which is happening into things. Maybe like a recent guidelines, that is a little amendments or little upgradations in the requirements which we want. So we should be actually ready to easily adapt and nothing. And we should keep always ourselves updated on what's been happening into the country's latest evidences, facts, evidence, best practices, guidelines, rules and regulations, maybe drugs and cosmetic acts, NACO, or whatever it is. People should be ready enough to say that, yes, I'm ready with all the things which is happening in my field of specialty. That's very, very important. And finally, I would say that the quality manager should also cover aspects on your risk managements, FMEAs and other things, new quality tools and other things, maybe now recently with your PREMs and other things. So all these things your quality manager should look into it to run the system effectively, sir.
Thank you. Thank you. So I thank all my panelists, and sorry, Dr. Rahul, for keeping you waiting. Now, Abdul, you can actually.